And so there's a myriad of things that are out there. But the ones that seem to have the best science and that I did some comparative analysis of, I think ZELTIQ was right in there. They had some good science and good papers, and they showed some decent results. And the problem I had with ZELTIQ and cryolipolysis or freezing of fat is at the time we looked at, they only had one body applicator. So if your fat didn't happen to fit into that little stick of butter that they had, or there was more than that little stick of butter, you're going to have multiple applications. And each application was going to cost the patient upwards of $1,000. So I was thinking of me as a patient, as a male executive in his 50s, and I'm looking at my periumbilical region and hips, which is common for men. I would have to have 3 different applicators of ZELTIQ, one above the belly button, one on each hip, for 3 separate hours, and they recommend usually 2 treatments. So I'm doing the math in my head, $1,000 a treatment times 2 treatments, I'm at 3,000 times 2, $6,000, and 6 hours of laying there, with this frozen thing on a body part. It just didn't seem like too many people were going to want to do that. I also looked at what was going to happen when new applications became available, because every time they went to a new body part, they needed a new stick of butter applicator, and those were not going to be free. They were probably going to be in the order of 10 to 12,000, they were telling me. And the cost to providing this for the patient, let's say you had a liposuction result and the patient wasn't happy, I'm happy to give away an Excelus treatment which has a $2.50 cost to me for a Bovipad and a half hour of my nurse's time, because there's no intrinsic cost to running the machine. Whereas if I had to give them a free ZELTIQ treatment, either they were unhappy with the first one or they thought they needed more than liposuction provided for them, I've got a couple of $100 expenditure, and I've got a lost opportunity cost of the hour that the patient's utilizing that machine. So ZELTIQ also had some problems that we started to find out about with cryolipolysis causing pain. So even though it was a non-invasive procedure, it turned out that there was a fair number of people complaining on websites and on the internet that they had some intrinsic nerve pain. So although the procedure in and of itself is non-invasive, there were some patients that had chronic pain, and there were some patients that had complete non-efficacy. And they don't really want to talk about what that number is, but if you can surmise from websites and stuff, it was somewhere in the 2 to 3, 4% that you'd freeze the fat and nothing would happen. I also didn't like the fact that when I compared it to Excelus, where most patients were seeing some results after the second treatment and a few after the first treatment, ZELTIQ had to wait 3 months in order to see the difference, because you were slowly killing the fat cell, and that fat cell, after it died, would expel the fat over many months, which is the internal fat deposit into the interstitial space used as a food source. I thought my patients in Louisville could out-eat any modest loss from ZELTIQ during that 3-month time and say, oh, nothing happened. So for all those reasons, I thought Excelus was a better option.